Michelle Okoye has suffered from delusions, severe depression, and mania. She's been diagnosed with the condition known as schizoaffective disorder. Okoye remembers the last time she was hospitalized with a severe manic episode. She didn't sleep for weeks. She was running down the hallways, yelling and screaming. Okoye later wrote a poem about what it felt like.
It's like polar opposites, North and South Pole. It's too much at once. It's like an atomic bomb went off and your thoughts are in a rush. Intensity is insane in the brain. Can't relax because your brain is out of whack.
At the time, Okoye was supposed to be sent to the county's facility for long-term psychiatric treatment, but there were no beds available. The treatment center sits on 5 acres in Alpine. There are 2 main buildings here that house 113 clients. They stay anywhere from 2 to 3 months to 2 years. Center Director Kristen Allred says most of their clients have schizoaffective disorder.
They have a tendency to have more symptoms that prevent them from functioning well in the community and or standing out in the community, responding to voices, agitation.
Allred says their clients benefit from a highly structured routine.
It starts at 6 o'clock in the morning for whether it be coffee social or getting people up and out of bed and starting to get them engaged in the day, to breakfast and then community meetings, we have several focus groups that occur throughout the day.
Clients have 21 group meetings a week. They have activities, outings, and therapy sessions. They take medication as well. The goal is to help them understand their illness and develop the skills to take care of themselves. Allred says everyone gets better, even those who are severely impaired.
They don't all get better to a point where they can care for themselves independently in a home, in the community, and work a full-time job. But everybody improves at some level.
Until just a few months ago, Alpine was the county's only long-term care setting for people with severe mental illnesses. The county has recently contracted with a 40-bed facility in Chula Vista. Those additional beds represent a 35% increase in capacity. Dr. Michael Krellstein is clinical director of the county's Division of Behavioral Health. He says the new facility should ease the long-term care shortage. But Krellstein explains the mental health system has other components, including acute care and outpatient clinical services.
It's tempting to think that maybe there's one, magical answer or special go-to resource that if we just had more of it, everything would be fine. But really, it's from a systems perspective, it's more complicated than that.
Krellstein says his department is constantly struggling with how best to spend its money.
How much of those resources should be community-based and early intervention and prevention and education? How many of those resources should be preserved for helping those who are struggling the most with frequent homelessness and food insecurity and trauma?
In 2004, California voters approved a 1% tax on millionaires to fund mental health services. San Diego County has about $172 million it can spend on certain types of initiatives, including early intervention programs. Tomorrow, we'll take a look at one county-funded program that tries to prevent at-risk youth from developing a severe mental illness. Kenny Goldberg, KPBS News.